Hello, everyone, and thank you for joining us today. We welcome you to today's webinar, How to Center Race Equity in Your Organization's COVID-19 Response. My name is Habib, Bako, Director of Community Building and Independent Sector, and I'll be facilitating this discussion to ensure that we stay on time and get to your questions. For those of you who are joining us for the very first time on an IS webinar, we say welcome to you. Independent Sector is a national membership organization representing a diverse set of nonprofits, foundations, and corporate giving programs working to ensure that all people in the United States thrive. Crisis situations such as COVID-19 amplify racial biases that are deeply rooted in our history. These historically rooted structures, processes, and practices often get in the way of equitable security and opportunity for all. The COVID-19 virus, an indiscriminate virus, has exposed the presence of racially unjust systems that have long decided who thrives, who lives, who dies, and who just gets by. The impact is anything but equal. It is a public health crisis that amplifies the disparities in our society. There is no doubt that everyone, no matter their race, economic or immigration status, gender, age, or ability, will feel the impact of COVID-19. But people who are already targeted, marginalized, and underserved will feel the pain more than others. For these communities, COVID-19 comes on top of existing economic, health, education, gender, and information inequities that have shaped their everyday lives. More than good intentions are required to reach those who feel the brunt of the pandemic's impact, especially the Black, Native Americans, Latinx, Asian Americans, and Pacific Islander communities. It is critical that organizations shift how they distribute resources and move towards system-wide transformation. Joining me for the next hour is Kerrien Suarez, Executive Director of Equity in the Center, for an interactive conversation about how organizations should proactively apply a race equity lens to their COVID-19 response and help ensure that their collective pandemic-focused efforts prioritize race equity. As part of this webinar feature, all lines are currently muted. We please ask that your questions, which will be taken at the end of the presentation, be submitted in the Q&A box on the bottom of your screen. This webinar will be recorded and posted on the Independent Sector website, and it will be emailed to you within 24 hours of this webinar. Please also make sure you take the survey at the end of the webinar. And we also ask you to join us in two major ways. Please visit independentsector.org/COVID-19 to learn, engage, and take actions. We have curated a list of resources and articles that we hope will be very helpful. And it also includes information on how to apply for the relief through the CARES Act, our collective advocacy efforts for COVID-19, and additional resources to manage your organization during the pandemic. We also ask that you visit independentsector.org/membership to consider joining us as a member if you're not a member already. With that, I want to turn it over to Kay, who has done incredible work to shift organizations towards centering race equity in their missions and work. This is even more important at this time. Over to you, Kay.
Good afternoon. Thanks so much, Habib. I appreciate the opportunity to join you this afternoon very much. And I'll start with a couple of words on equity in the center, but first, a work from home caveat. There is a small chance a child may wander in during this webinar. So just wanted to give that little heads up before we begin. So to start, what I'm going to do is just share some context on equity in the center and our work, and a little bit about the race equity lens we're going to spend most of this afternoon talking about, before Habib and I have a bit of a dialogue on some questions he's prepared, as well as addressing questions that you all drop in the chat. So we look forward to an interactive dialogue with you. So Equity in the Center has been around publicly since 2017, and we work with leaders and organizations to shift the mindsets, practices, and systems to drive race equity. And loosely or generally, we talk about that as building a race equity culture, since the research we published in 2018 is called Awake to Woke to Work, Building a Race Equity Culture. And I'll talk a little bit more about that in a moment. But our work focuses on disseminating that research, supporting organizations in applying the best practices as they work to center equity in their organization's work. Next slide, please. It's always helpful to start these conversations by grounding in some definitions. And these are the three we like to start with at Equity in the Center. And I'm not going to read what's on the slide, but we'll just speak to them briefly. So race equity, as Equity in the Center defines it, and as it will be applied in our conversation today, is essentially if we were to aggregate all of the social outcomes data that our social sector organizations work on, so health, education, income, housing, criminal justice, things of that nature. If we were to disaggregate all of those outcomes by race in society broadly, there would be no disparity by race. That essentially is race equity, and that's the vision that many of us are working toward. And then inside of an organization, which is sort of where Equity in the Center spends most of its time thinking, is if you were to disaggregate all staff data by race, so income, seniority, performance, compensation, promotion, retention, investment of professional development dollars. If all of those staff outcomes or data points were disaggregated by race, and there were no disparities, that would be race equity inside of an organization. And so we're very far from race equity in society, since race is the biggest driver of disparities. And when most organizations disaggregate their staff data by race, you find that they are quite far from race equity internally. What we're going to spend most of our time talking today about is applying a race equity lens. And applying a race equity lens essentially is pausing at every point in your work, every inflection point in your work, whether it's making a decision about hiring an ED or a volunteer or recruiting someone for your board, entering into a new strategic partnership, raising a fund, awarding a grant, you would pause and consider the potential disparate impact of that decision or investment or partnership by race. And it's a conditional, so people struggle with it a bit in learning to apply this inside of an organization. So there are some helpful tools organizations can use, such as a race equity impact assessment. You can find some links to those on our website, as well as on racialequitytools.org. Race Forward has a good one. So some of the questions that we're going to talk through as we go through the webinar are essentially a race equity impact assessment, a set of questions that are going to cause leaders to pause and consider the disparate impact of, in this case, COVID, but in general, all of your work and decisions and partnerships by race. And a race equity culture is what Equity in the Center focuses on, and we define that as an organization whose culture is proactively focused on mitigating race-based disparities inside of the organization, as well as outside of the organization in the broader community and society. Next slide, please. And this is the race equity cycle. Some of you may be familiar with it. I'll talk through it very quickly since we don't have a lot of time today, but I'll just give you a few characteristics of each stage. So we reframed what's traditionally called diversity, inclusion, and equity as awake, woke, and work. So awake is the stage most folks would call diversity. That's where the work is very transactional and focused on literal variation by race inside of the organization. So at that stage, an organization is counting people of different races inside of the organization, keeping track of it, and trying to increase that number. So generally, you'll see organizations entering into partnerships with affinity groups, professional or academic institutions to pull folks into their organization. What's not considered at this stage of the work is the retention of those individuals. So essentially, the different lived experiences that folks of color have once they come into an organization, as well as the different lived experiences that they have in broader society. Woke is what most people traditionally would call inclusion, and that's the stage of the work where an organization is proactively focused on transforming their culture from a white dominant standard to one that has a multiplicity of identities centered as part of its organizational norm. So at the awake stage, the focus is on assimilation to a white dominant standard, which is generally unspoken, but still explicit. Folks aren't talking about race, but there is a very clear standard of behavior which aligns to a white dominant norm. At the work stage, an organization would be naming the white dominant standard and naming the fact that they're intentionally trying to move away from it by creating a more inclusive, or as we would say, a race equity culture. This is also the stage of the work where an organization would name that it is not the responsibility of people of color inside of the organization or in broader society to educate white folks and folks broadly about the need for equity, or to educate people on their lived experience. And this is where you'll see an organization explicitly name that the lived experiences of people of color in broader society are different than those of white folks, and that the lived experiences of people of color inside of organizations are different than their white peers. At this stage of the work, you'll often see people introduce affinity groups, as well as begin what folks will sometimes call an equity audit, or an intentional race equity process that is cross-functional, has a timeline that extends over a period of years, and is designed to transform culture, operations, policy, and practice. The work stage, what most people will call equity. Equity is really the outcome, but at the work stage, we say that an organization is as proactively focused on driving race equity externally as it is internally. And the shorthand that our team will sometimes use is we say that at the work stage, the equity statement or the mission around equity that is on its website and in its public materials actually matches at the work stage the internal lived culture of the organization. Whereas in most cases, there's a disparity between how an organization talks about its equity work and its a desire to achieve equity, versus the values that it's actually living every day with its staff and in its broader community. So that constitutes the race equity cycle. And if you go to the publication, you'll see a set of characteristics that outline how organizations move through this cycle. There are a set of levers, 7, which are around the outside, and those are essentially clusters of best practices. So the race equity lens that we're going to talk about today, organizations that are proactively working toward building a race equity culture would apply that lens as part of their work cross-functionally. So today we're going to be talking explicitly about COVID, but what I'd like you to think about, as I'm sure many of you already are, is asking yourselves these questions around your COVID response, but also thinking about whether or not you were already or have ever asked these questions about your work generally. Next slide, please. And Habib shared that he sent around some pre-reads he and I had discussed before. So the questions we're going to raise on these next 2 slides are pulled from the Consumer Health Foundation blog by Unique Redwood, which was shared. And I chose to center the conversation around these questions or share these questions because I think it's a very concise illustration of how one applies a race equity lens when talking about COVID. And I'd encourage you to adopt these questions, but please give Ms. Redwood and the Consumer Health Foundation credit for them. So the first question, and Habib, I would invite you to interject at whatever point you think would be helpful if you want me to clarify something or you have a question. So the first question is, how does your response, even in the midst of crisis, contribute to long-term systems change? And so the example that Unique shared is, can your organization meet a basic need and educate community members about the kinds of policies that are being proposed and passed that could make their lives better in the long run if made permanent? I think one thing, this is a statement you may have heard in the past month or so, but in the Black community, there's a saying, and it goes like, when white people catch a cold, Black people get pneumonia. And so within the Black community, that statement has been being said for generations, but also as COVID emerged in February and March, there was a general feeling that as this crisis unfolded, it was going to unfold along historic and structural lines of inequity in our society. And so what we have seen in the past 2 weeks is some really solid data sets from states which reflect that. So reflect health disparities at the structural and the societal level that are now playing out with COVID deaths. So you see that in disparities between the deaths of Black communities, the rates of death in Black communities. You can also look at the Navajo community in Arizona and the rate of infection and death on the reservation in Arizona versus the rest of the state and the disparity there. So as you're addressing this immediate crisis and unprecedented crisis, as so many folks are saying, are you being aware of how what we're observing on a daily basis is a reflection of structural inequity and structural racism? The next question is, how are the voices of impacted communities centered? And the example that Ms. Redwood shares here is, have impacted community members been provided with stipends to join a resource allocation committee? I think what often happens during crises, but also just in general in our work in the social sector, is that large, well-resourced, often white-led organizations rally to help by providing solutions that originated in their community or at their table, so to speak, rather than directing attention to the communities that are being most impacted, where the solutions actually lie, but the resources do not. And so I think what's being highlighted here is, are you centering what folks in communities that are suffering right now actually say that they need? So for example, I was talking with a colleague recently who was supporting organizations who are paying the funeral expenses for undocumented immigrants. So as you think about what are the solutions that we can put out there in the midst of this crisis, are you actually providing solutions that communities would consider valuable? And are you replicating something or attempting to create a solution where one actually already exists but is not funded, i.e. in an organization or a community that is led by people of color? This third question I think is really important. So what quantitative or qualitative data do you have driving resource allocation? And what does that data tell you about the experiences of various racial and ethnic groups? And importantly, how are women and LGBTQIA people of color particularly impacted? So disaggregating data is a theme that Equity in the Center talks about, and many of our colleagues focused on equity are talking about. So as you're developing solutions to address the COVID crisis, are you following the data? So are you following the trail to the communities that are experiencing the greatest disparities? So for example, many people have lost their jobs in the past 4 weeks, but when you disaggregate by race, there are particular communities, the Latinx community, the Black community, the Asian Pacific Islander community, that have been disproportionately affected. And women in service professions have also been disproportionately affected. So how are the solutions and the resources that you're going to allocate going to address those disparities? Next slide, please.
Okay, can I just jump
Sure.
in? So we have a question from Jessica that's very related, that how can large organizations that have all these affiliates and affinity groups, how can they create solutions that are just targeted during this COVID time in their response?
My advice would be to partner with organizations that are led by the communities that are most impacted. And so when Habib and I were talking before, we selected the pre-reads because there are a lot of solid recommendations on how to do just that. So Lori Villarosa's article from the Nonprofit Quarterly, the Weisberg Foundation's letter, Weisberg along with a number of other foundations in the DC region, wrote a letter with recommendations on how to prioritize racial justice and Black, Indigenous, Latinx, and other POC communities and organizations as part of this response. And both of those articles recommend specific organizations that you could use as a gateway to POC-led community-based organizations that have been working, in this case, on issues of health and equity for decades. So what's important to consider, like we were talking about, or as I was saying earlier, about not coming up with a solution to a challenge that a community has been facing for decades and for which there is an existing under-resourced infrastructure in place, rather than creating a new fund. Not that a new fund is not helpful, and the COVID response funds have been highly impactful, but look to the communities that are living sort of on the bleeding edge of health inequity in this case. What are the organizations that have been devoting resources to that crisis, which has existed for decades in that particular community, and how can you channel your resources to those organizations? How can you invest in that work?
It makes sense, great. And I had a follow-up question around the voices. that are impacted. I know we had a conversation yesterday around this question that keeps coming up about who's at the table. We should be at the table and making sure that POC leaders are represented in the conversation. How do you, from your guidance, how do you factor in trust in that conversation around trust in institutions, trust in organizations? How does that intersect in setting the table?
That's a great question. And I don't think it's a simple one. Like, it's complicated because, as you said, there's trust inside of an organization. So depending upon where an organization is on the race equity cycle, and most organizations are at the awake stage when we surveyed our stakeholders. So folks who are connected to us, attend our events, 75% of them were awake. So just at the beginning of their journey. So those organizations don't yet have a race equity culture. And when you disaggregate by race, for example, if you were to use staff engagement data around trust, there's likely to be a disparity around race. So I think organizations have to think carefully about the level of trust that exists across racial lines inside of their organization. Then when you look out at the broader community, there's often distrust between large, well-resourced, generally white-led organizations and smaller, historically less well-resourced, community-based organizations that are led by people of color. The trust between those organizations is not there because the smaller POC-led organizations have difficulty securing funding from larger, well-established white-led organizations. And there's often a decades-long history of mistrust, where resources have been redirected or not allocated to the community, but rather channeled through a larger white-led entity that doesn't have the relationships in the community or the expertise with the particular issue. And so I think when we were talking yesterday, I mentioned if you're thinking about setting your table and you can't think of any leaders of color or organizations led by folks of color currently working on these issues, that's something to pause and think about, because it speaks to not only those community-based organizations' level of trust for you, but your level of trust of them. Because if they were trusted peers and partners, there would have been some trust presently. And in the midst of this crisis, you wouldn't find yourself needing to scramble to identify into individuals or organizations with whom you could partner. So I think it's just a moment to pause. So we were talking about setting a table. If you're setting a table and then inviting leaders of color to come and set a table you've already set, that's not equity. I think it's progress for many organizations and for society broadly, given that folks of color have been historically excluded from the table. But if you're going to set a table, like put on the tablecloth and set out all of the dishes, have other folks sit down first and then invite people of color to take some seats that are left, that's not setting a stage for equity. That's to some extent setting a stage for tokenism. So what I would suggest as an alternative is, as we were talking about before, investing in the tables that leaders of color and communities of color have been forced by structural racism and inequity to set in their own communities, and invest in that leadership structure, cede power to that leadership structure, and fund it sustainably, or partner in an equitable manner that explicitly names the legacy of structural inequities and build a table in partnership with those leaders, as opposed to setting a table and then inviting them to it.
Totally agree, Kay. And I just wanted to build on this, a question from Christine around, from a POC-led organization that gets approached by a white-led bigger organization, how do they in this process protect themselves from like an IP standpoint, but as well keep themselves open to partnerships? So it's this idea of how do you build that path of trust, but then sustaining your identity in the process?
Yeah, I think that's a great question. And it's a tricky line to walk, and a power dynamic to balance, because historically, being too explicit about historical inequity and power imbalances in that relationship would mean that you might not get funding that you desperately need. So my advice and recommendation would be, like, in as much as is possible within the context of those two organizational relationships or the relationship between two leaders, to be explicit about the legacy of inequity and the disparity in power between those two parties. And sometimes just naming something can put it into the space. There are also a number of articles that could be shared that flag this issue. So I'll give an example from my own life. So, as an advisor, I advise a white-led organization, a large, well-resourced white-led organization, and they wanted to reach out to and partner with a less well-resourced, historically Black-led organization. And they were confused about why that organization was not returning their calls and wasn't interested in meeting with them. And so I shared a series of articles that talked about the historic disparities in resource allocation between white-led organizations and POC-led organizations, as well as the legacy of appropriation of ideas and programs that happens regularly, to the point that it's something that people of color and organizations of color joke about. And so I shared this with the white-led organization, and they shared that they had not ever heard that before. So I'm just sharing that as an example of sometimes you can say some things and name issues, and sometimes providing a citation for people to reference. Like, this is something I'd appreciate you read before we sit down, because the power imbalance and the legacy of inequity has to be named if we're going to begin to move toward building a race equity culture. Because what a white-led organization, or even a historically white-led, predominantly white, but currently POC-led organization is in a position to do within a system of white supremacy, is to invite someone from a POC-led organization to the table and then run, AKA take their idea or get money for their idea. And in some cases, like, communities have examples of white-led organizations getting millions of dollars in funding for programs that they run for decades and could barely raise money for. So just being explicit about that dynamic in a way that, as much as possible, calls the other organization into an honest conversation about how you can work together. But it's not easy.
No, that totally makes sense. And I know we talked about it yesterday, finding the right balance with fidelity, and also being cognizant of that during a crisis. There's the pace. And I wanted to invite you to kind of talk to us a little bit about how do you try to be very responsive, but and keeping in mind that certain organizations are at a different place in the cycle. So how do you respond and be timely, but at the same time, you keep the fidelity and trust and center racial equity in this time?
Sure. Because I think I've heard two sort of camps in response to COVID. So one is, this is playing out along lines of inequity and we have to rally. So we have to raise funds. We have to make sure that the folks who need resources get those resources. And I think that's been happening in many communities in a really powerful way. I think there is another group of organizations who are earlier in their work and as not attuned to issues of structural inequity nationally and in their particular geography, that have questioned whether they can persist with internal equity work in the face of COVID. I think that has become a very different conversation in the past 2 weeks, where we have compelling data from states on race-based disparities. But in the period before the the disaggregated data was coming out, I heard from organizations that weren't sure they could persist, felt they needed to reallocate money that had been, set aside for race equity work to immediate COVID response, or to just covering people's salaries, depending upon what their particular financial situation was. And I think it's a both and. I mean, for organizations that have been furloughed, for organizations whose funding has completely disappeared, you're in a completely different category if you have to lay people off immediately or just shut down for an indefinite period. But for organizations that are fortunate enough to have some reserves or have a funding structure that allows them to stay open, if your work is continuing, then the work of centering equity in the midst of a pandemic must also continue, because the pandemic is unfolding along historic structural lines of inequity. And if you are going to have a COVID response, that response would need to integrate a race equity lens and a more intersectional equity lens, as Ms. Redwood's questions highlight, around identity, gender identity, class, ability, or else you're not actually responding to the crisis at hand. So on the one hand, you may have to pause because you're furloughed or the funding has disappeared. On the other hand, you do need to double down on your commitment to equity as an organization, because this is a crisis that's unfolding along historic lines of inequity. The people who are dying are not evenly distributed by race or class or education. And so if you're going to formulate a response to the crisis that's unfolding in your community, you need to be mindful of equity and how inequity is playing out in your community.
Thanks, Kay. And I just want to remind everyone to please use the chat box to put in your questions. And Kay, I also wanted to remind one of the things you told me yesterday, that another option is working with organizations that already are in the cycle and further on to help then advance, help you, guide you in the response. If you're not there yet, you can work with others collaboratively to get to that stage. So please remind everyone to put in your questions, and we'll keep going through the slides and turn the Q&A in a couple minutes.
Thanks. Yeah, thank you. You can advance to the next slide just so folks can see the next set of questions, which are build on the first three. But to your question, Habib, yes, if an organization is very early in its equity work, you can look to organizations like the ones that publish the articles we shared as pre-reads for leadership on this issue. So for example, if you're early in your journey, you're not well positioned to make recommendations on equity to your community, for example, you can share the recommendations of an organization that has been focusing on this work for decades. And there were some examples of those organizations in the pre-reads, many of which focus on the philanthropic sector, but explicitly said the role that they play is to connect not just funders, but organizations to community-based POC nonprofits that are leading work on the ground. So you can share resources from communities, or rather organizations that have been historically focused on health inequity, racial justice, but it's important in doing so not to appropriate that work. So to share it as work coming from POC-led, community-based, or in this case, a couple of national organizations. So what I had shared that I had seen happen before is there might be a list of resources that a POC-led organization distributes. And then that list of resources then becomes another organization's list of resources. So my recommendation would be that you share the list of resources with its provenance in its entirety. So rather than recreating the wheel or appropriating the work, to disseminate the work of community-based POC-led organizations that again have been thinking about this work or these challenges around health inequity for decades. I can go through this slide quickly, Habib. It's about 2:30 before transitioning to the questions. Does that work?
Oh, that works, because we started taking questions. So yes, please go through the next slide. And again, I ask folks to submit some questions. After the Kay goes to the next slides, we will switch fully to Q&A.
Sure. So I'm not going to go through all of the questions in blue on this slide, because I feel like we talked about some of them on the previous slide, and this in general as we were framing using a race equity lens. So these are the final three questions from Ms. Redwood's blog post. And so the first asks, what are the possible unintended consequences of decisions you might make? So to the conversation that Habib and I were just having, raising a fund or replicating a solution through your organization that already exists in your community, but of which you are not aware because it's community-based and led by POC folks that are not part of your existing network. And what are some possible unintended consequences of replicating that work when you could otherwise be funding existing work? The second question, what additional disaggregated demographic data will you collect, track, and evaluate, ties to the question on the previous slide. So as you develop your response to COVID, you raise a fund, you launch a program, you enter a partnership, how will the data that you collect as part of this new partnership, for example, inform the work that you will do moving forward? But the point that I would highlight that I mentioned earlier is how will this process for disaggregating demographic data in your COVID response influence your broader approach to tracking data in your work overall? Because disaggregating data by race and other identities is critical to assessing where an organization is and not just building a race equity culture, but in achieving the desired impact. And one of the unintended consequences that can sometimes happen when you launch a program or a fund is you launch a program or a fund to explicitly benefit a particular community. But then when you disaggregate the data and you look at those who are actually able to access that resource, the funding or the program, it's not the individuals from the community that were originally being targeted necessarily, or not at the rates that may have been hoped for. So disaggregating data, tracking data and disaggregating it as you develop solutions over time is important. And then lastly, the question is, how are the actions you're taking grounded in history? Habib, I think this ties to a question that you raised when we were preparing for this around the difference between racial equity and racial justice. So racial equity, if you're applying a racial equity lens, you would be explicit about historical structural inequities, white supremacy. But one of the differences between racial equity and racial justice is that there's a focus on understanding and acknowledging racial history if you're using a racial justice frame. But if you are beginning to apply a race equity lens, that is a history that you would begin to talk about. But it's important to name that race equity work and racial justice work, or racial equity and racial justice work, are not the same necessarily, though the words are often used interchangeably. And in one of the articles that we shared, Lori Villaros's article from Nonprofit Quarterly, there's actually a chart in it that gives you the characteristics of a racial equity frame versus a racial justice frame. And justice, there are different camps or philosophies around racial justice, but there's an element of reparation in the racial justice frame, of making whole, of naming history, of creating an aspirational vision of a fair and inclusive society that goes beyond a racial equity lens. And so I think it's important to name that as you're grounding in history, to be clear about the distinctions between racial equity work and racial justice work. And if you're just beginning to think about racial equity, then justice is aspirational for an organization at that stage, as it is for most organizations who are working in a diversity space generally and haven't even yet really evolved to being robustly or squarely in a race equity culture.
And Kate, there's a question that came in around data collection. If an organization is trying to put out a survey or has questions around how do we figure out that the right voices of communities are impacted, and how are we making sure that we craft the questions that we are asking or the strategy in a way that actually gathers the most pertinent information. So it's around a tactic, like are there resources that you can point folks to around when they design their response strategies?
Some of this goes back to trust, like you were asking about earlier. So my overall recommendation would be that the individuals who are part of the communities you seek to engage are involved in crafting the instrument. So that's sort of seeding power. Like, that's a race equity culture. And the example I'll often use with organizations, in the foundation world, grantee inclusion for a long time was a proxy for building a race equity culture inside of an organization. So they'd start an external committee or have some initiative for grantee inclusion, which meant they didn't have to change their internal culture, and meant that they didn't have to bring individuals from the communities they were serving into the power structure of the foundation, so that they were the ones inside of the organization, for example, crafting the instrument, drafting the survey. So if your institution does not have the voices at the table that reflect the community you're seeking to engage, I would encourage you to seek partnerships that are grounded in trust and values of equity. And that is a lot easier said than done, because generally when large, well-resourced, often white-led, but increasingly led by people of color in some cases, reach out to community-based organizations. To the question earlier, there is this inherent power dynamic where you are extracting information from the community you seek to serve as part of a survey or an interview. And so that's why I say it's easier said than done, because the process whereby you engage the community you seek to serve has to be steeped in values of equity that value those individuals as equal humans, compensates them for their expertise. And in the long run, in terms of building a race equity culture and making progress toward race equity in our society with the vision toward racial justice, those people, those humans and their expertise need to live inside of your organization. That's building a race equity culture. And so what that would mean is years from now, when you're creating this survey, you have the people on your team that could inform those questions. But in the present, when you may not yet have them on your team, I would encourage you to seek out partnerships with some of the organizations that were mentioned in the pre-reads. And for some of you who are in different, particular geographic ecosystems, there may be regional affiliates of these organizations that you could partner with to get insight into what communities most need. I think my overwhelming advice is to do that in a manner that is not tokenizing and does not deepen the power inequities that exist in these relationships.
Thanks, Kay. And I just want to take a moment to acknowledge the questions about the pre-reads. We will be resending the pre-reads after this webinar, so we'll make sure that everyone gets all the links that were sent yesterday. Kay, building on the point you made about the organization, and then there's a question around working with colleagues around if half of the organization is coming at work from a race equity lens, so very targeted, and the other half is more around universal strategies. Like, what are some of the advices that you have when there is that split inside a system?
I think there's that split often inside of a lot of organizations. There'll be a particular leader or a particular team that is more focused on race equity than the organization more broadly. And sometimes those teams have the ability to move money and to make a lot of change sort of in their lane, but they're not representative of the broader organization. I think with respect to COVID, I would lead with the data that has come out in the past couple of weeks, which I think makes but I'm coming from my perspective, a pretty irrefutable case that a race equity lens has to be applied to your COVID response, because Black people and Latinx people and Indigenous people are dying at alarming rates that are sometimes 10 times their representation in the population of a city or a state. So if I would say around COVID specifically, if you were getting pushback on a race equity response, is to lead with the data, which often in race equity work or DEI work can help you make inroads with people who are skeptical of race equity, because the data, particularly when it comes from a reputable source, reputable being infused with white supremacy and sort of white dominant standards, gives people pause. So that would be my recommended approach for COVID, is to lead with the really just tragic numbers that we're seeing. I think in terms of a race equity framing more broadly, so if you're talking about your just work in general, regardless of COVID, that is a case that it often takes people years to make. I think you do have the data coming out around COVID to use to illustrate historic structural inequities that have existed, and to support you in making the case for why this is something to which you should pay attention beyond COVID, because there's nothing new about what's happening with COVID. Like, all of communities of color predicted it from the time it started. There is nothing new under the sun when it comes to structural racism and historic inequity. This is the same racism that we've been dealing with for decades. So I think you could, just like you can lead with the data on COVID in this particular case, you could also use the crisis and the health inequity and disparities around COVID as representative of patterns in our society more broadly. That should give your colleagues pause. But in general, when we work with organizations, I'd say with equity in the center, is we advise folks to look for champions. So people outside of your immediate team who might be sympathetic to the issue of equity, who could work with you as allies to push an agenda for race equity inside of an organization. And often those individuals are white allies. So if you're a leader of color, for example, folks of color raise issues around issues of race and equity often and are not heard because it's received as an opinion that's being shared because of their particular experience as a person of color. So if you're a leader of color trying to make the case, a strategy we often recommend that has been successful for me, it's been successful for colleagues inside of organizations or on boards, is to work with a white ally who also sees the value in the work, and strategize together as to how to move people along. You can bring in training opportunities, you can share articles, but co-conspirators are critical if you're trying to move the dial in an organization broadly. But making the case can take years. And I think like building a race equity culture, the paper we published, one reason we did that is we thought, or we hoped that leaders could use that as part of making the case internally. So I'll stop there.
And Kate, just to build on allies, what would you, so a question that came up was around organizations that are starting their journey, and how do they start building this bridge in reaching out to the allies and in bridging whatever gaps and divides that exist. Like, what is the best way to reach out to, say, community-based leaders that are already tapped? Like you said earlier, this is not new for people of color, and you know they have to serve the communities. They're in the front lines. So how do you, from an organization that wants to bridge this divide and actually get into conversation with the community-based leaders, what are some tangible ways to do that and that you've seen that has worked?
I would say give them resources. And we're, like you said, Habib, you're going to share the pre-reads again, and some of those have some clear recommendations about engaging in trust-based philanthropy or partnerships. So often, if you're a community-based POC-led organizations, it is outrageous the number of hoops, for example, that you have to jump through to get $10,000. So an example would be if you are in a particular geography and so you do some research, you call some people and you get the names of a few organizations that are working on a health and equity issue in a community that you're trying to target and with whom or with which you might like to partner. If you have resources, if they're program resources or financial resources, once you connect with the organization, channel the resources to them without making them jump through innumerable hoops to prove that they're worthy of the partnership or the investment or the resources. Like, that's what will help build trust. When white-led organizations in a particular ecosystem approach POC-led community-based organization, there are decades of history, in some cases centuries, depending upon the geography, decades of racism between those two organizations, whether the white-led organization is aware of it or not. So often this is not a quick fix, but we're in a pandemic. So this is absolutely a crisis for which people need immediate resources. But I'd say as an example, that's one way of doing it. And so in philanthropy, people talk about it as trust-based philanthropy. So I heard about your work, like I've done some research on it. I see what you're doing. I'm going to give you some money. Or I have this shipment of N95 masks or formula or whatever it is that you have. Where do I send it? As opposed to making a community-based POC-led organization prove their worthiness for your attention, your time, or your resources. In a crisis, that would be an immediate way to begin to build trust. So I'll stop there.
We have another question that came around leading with data. And how do we, so from a technical standpoint, using data as a center to start conversations, but how do we then avoid the mental models and the stereotypes that the adaptive piece of this that comes in, like how do you walk that line during COVID-19 response?
Yeah, this is, I mean, ultimately it's a humane, like this is about shared humanity and people dying. But the reality of it is, and I don't mean to minimize what's happening with COVID at all, is that people have always been dying. And so the point that you're trying to make is a point that many of us have been trying to make for decades to varying degrees. Like one of the things I'll often say when people ask, like, why do you do this work or how do you end up doing this work? And it's because like my people are dying every day. So yes, COVID is a very tragic illustration of structural racism and health inequity in this country, but we have been dying for centuries, and not Black people, Indigenous people, Latinx folks, folks with disabilities. So when I say there is nothing new under the sun, people are dying at alarming and tragic rates from COVID, but we have been dying. So yes, use the data to make the case. And then you have to also try to root in some shared humanity, because the challenge to our collective work for these many years has been proving that communities of color are worthy of life, of investment, to the point that they will have the health, for example, outcomes of the white population. So often you need the data to get someone's attention because they will just push back and push back and push back. And you can use the example of the Surgeon General, was it last week, who said that Black people should drink less liquor and smoke less, and maybe that would help. That's not helpful. That's just a reflection of white supremacy. But that's something that has always been there and is very familiar. So I think, you know, you can use COVID and the data on COVID as an illustration of inequity that has always been there. And so this is just a present example of how folks of color die at disproportionate rates. But historically, in terms of how our lives are valued in this country, even though we have been dying, action was never warranted. So I think it's a balance between presenting the data and then having a humane, supporting a humane response to that data. Because ultimately the reason why we have structural inequity is because we are not all valued equally as humans. So yes, lead with the data if that's what you need to get people's attention, but ultimately it comes back to the hierarchy of human value and the fact that it is acceptable in this country for some people to die.
Yeah, thanks, Kay. We will have two more questions, and thanks for all your insights. There's a question from Paul about organizations, and I know we talked about this yesterday as well, serving people with disabilities that often struggle with already compounded factors that are impede their thriving. So what are some of your thoughts and approaches that already, with the amount of resources that are lacked, that this crisis would actually amplify those communities? Like how do you best advise an organization to respond, specifically serving the folks with disabilities?
I mean, that's an excellent point. And folks with disabilities live at the bleeding edge of health inequity, and have for hundreds of years. My advice is the same for folks with disabilities as it is for folks of color. So my advice would be to look at organizations that are led by folks with disabilities that have been advocating for their rights going back decades, and channel resources to those organizations. So again, like rather than replicating a potential solution, look to the leaders and organizations that have been in disability activism for decades. What are the issues that they're raising up? Because if you look at Indigenous national and regional organizations, if you look at Latinx regional and national organizations, if you look at Black and other POC, Asian and Pacific Islander organizations, all of them are releasing advocacy agendas and being really clear about what their issues are. So for the disability community, for example, there are these issues around eugenics and the triaging of healthcare, which mean explicitly in some cases, because policies have been shared publicly, that if you have a disability or you have a certain type of disability, you will not get a vent, like you will not get care. So look at the organizations led by folks with disabilities that have been lifting up the issues around COVID and their community, and channel resources to them. So it's the same recommendation as for other identity groups.
Okay, I think this is I know I said we only had one, but I have one more question, more personal to you. And how do you, because you've been in this space for so long, and this is a time where a lot of people are coming from a collaborative standpoint. So as a practitioner, how are you holding both the urgency for folks to act but also the need for folks to be really explicit in their action and moving towards results. So using data, using strategies that actually move the needle, like you mentioned, the Surgeon General, like how do you hold that mental model at the same time and then bring our allies to the table? So can you talk about that from a practitioner standpoint?
Sure. I think it's kind of the classic both and, um, and it depends because it depends upon the work that you're doing. So for example, I was talking about the colleague who was supporting an organization that supports undocumented immigrants and supporting with funeral expenses. So not all of us are in a situation where we are dealing with a community that has lost everything. There are many people on this call and many people who are part of like Equity in the Centers Network who are infrastructure organizations who are experiencing financial loss and experiencing hardship, but this is all happening on a continuum. And small, historically POC-led, community-based arts and other organizations are experiencing much more hardship than others. So I think it's a conversation that has to be relative to where you're located on that continuum. So you want to free up resources immediately around COVID and get it to those people who are sort of at the bleeding edge of what's happening right now. And those are decisions that we see organizations making really quickly. So creating funds and then creating really short applications for community-based POC and other organizations to apply for those funds, like 2 questions, for example. But then in terms of your internal equity work, I think it is a moment to pause. Like you have to balance the urgency to respond to COVID. And my bias is always going to be toward releasing resources, whether they're financial resources or programmatic resources, to community-based POC-led, or as you were talking about, organizations that are led by folks with disabilities, releasing resources to them immediately. Then the flip side of that coin is, so then what does this mean for how you are going to do your work going forward? So if you took a really intentional race explicit lens and applied it to how you responded to COVID, what are you going to do with all of the rest of your work going forward? Some of which you will have to continue to address through the pandemic as you also address COVID, because you can't just have a race explicit or apply a race equity lens to your COVID work. It should be then applied to your broader organization. So I think it's a matter of triage. So the immediate resources, getting those to folks and organizations that need it the most, and then asking the same set of questions that Ms. Redwood raised in her blog, asking those questions about your work period. And what are the things that you can do differently immediately, like disaggregating data that doesn't generally cost much or any money. So I'll stop there.
And I know I said, so we have 2 minutes left, and I'll see if we can squeeze one quick question before closing out. It's around, so the flip side of it is, if you're new to this work, how do you start the conversation internally? Okay, can you just give one quick tip on how new employee, how do you start this equity conversation?
Okay, you cut out a little bit, but I think what you said is, if you're totally new to this work, how do you start the conversation?
That's correct.
Okay, so one thing in follow-up, I can share this with you, Habib, is there's a part of Equity in the Center's publication called How to Get Started. And so we turned it into, it's like a 2-page PDF, which has a set of recommendations. I think the first one the first one may be creating a shared language, but in the top 5 is disaggregating data. So you could, for example, in a meeting, ask a question about disaggregating data, like, oh, we're talking about serving, doing a COVID response. So you could ask, is there a race equity analysis to this work? Or have you disaggregated the data on participants who are able to access, insert whatever the program is? So there is definitely the inquiry strategy. Have you applied a race equity analysis? Just asking those questions explicitly. And one reason that Equity in the Center has focused on creating tools is because often sharing an article or sharing a tool with a colleague is a great way to start that conversation. So I'm going to share this with you in follow-up, or I want to share this with you before the meeting so that we can talk about it. But I'll make sure I share with Habib the PDF of how to get started. So I would say ask the question. So what does it mean that 98% of the participants in this program we just launched, or the applicants to this fund that we just launched, that 98% of the people are white, or that 98% of the organizations are white-led, or that 98% of the people who took advantage of this program are middle class and not working class individuals or working poor individuals who we actually wanted to target. So asking the question about disaggregating data is a great place to start, as well as trying to create a shared language on equity, because when you ask about race equity, there are as many interpretations of what those two words mean as there are participants in your meeting.
Thanks, Kay. We are at time. Thank you for all your questions, everyone in that chimed in. And thanks, Kay, specifically for your breadth and wealth of knowledge. Please connect with Equity in the Center on Twitter, Facebook, and on your website. And as you sign off, you'll get a survey. Please complete that to help us improve our webinar offerings in the future. And a recording of this presentation will be sent to you within the next 24 hours. We have a webinar on Thursday, a policy update on COVID-19 response and recovery. We welcome you to join us as well. Have a good week and please be safe.